Welcome to your health channel, your channel for health tips and healthy living. Dear esteemed viewers, today's crucial discussion is focused on stroke warning signs. Stroke, often referred to as a brain attack, is a medical emergency that requires immediate attention. Join us as we delve into 15 warning signs of stroke, each accompanied by explanations and justifications to help you recognize and respond to this life-threatening condition. Sign 1. Sudden numbness or weakness. One of the most common warning signs of stroke is sudden numbness or weakness, especially on one side of the body. This occurs when a blood vessel supplying the brain is blocked or ruptured, leading to impaired blood flow and neurological symptoms. Numbness or weakness often indicates damage to the brain's motor pathways, requiring urgent medical evaluation and intervention. Sign 2. Confusion or trouble speaking. Confusion or difficulty speaking, including slurred speech or trouble finding the right words, can also signal a stroke. This impairment in communication arises due to brain tissue damage affecting language centers. Prompt recognition of speech changes is crucial, as timely treatment can help minimize long-term disability and improve outcomes. Sign 3. Trouble seeing. Blurred or double vision, sudden loss of vision in one or both eyes, or visual disturbances such as seeing flashing lights or spots can indicate a stroke affecting the optic nerve or visual processing areas of the brain. Visual changes often accompany strokes and require immediate medical evaluation to prevent permanent vision loss. Sign 4. Dizziness or loss of balance. Feeling dizzy, lightheaded, or experiencing a sudden loss of balance or coordination could be indicative of a stroke affecting the brainstem or cerebellum. These regions control balance and coordination, and disruption due to stroke can lead to difficulties in movement. Balance and coordination problems may precede other neurological symptoms and should not be ignored. Sign 5. Severe headache. A sudden, severe headache, often described as the worst headache of one's life, can be a warning sign of a stroke, particularly if it occurs without any known cause. This type of headache may indicate bleeding within the brain, known as a hemorrhagic stroke. Headaches associated with stroke require immediate medical attention to prevent further brain damage and complications. Sign 6. Difficulty walking. Difficulty walking, characterized by stumbling, loss of balance, or a feeling of heaviness in the legs, can result from a stroke affecting the motor pathways in the brain or spinal cord. This symptom often accompanies weakness or numbness on one side of the body. Changes in gait or mobility should be evaluated promptly to determine their underlying cause, including stroke. Sign 7. Sudden behavioral changes. Sudden changes in behavior or personality, such as agitation, confusion, or uncharacteristic mood swings, can be indicative of a stroke affecting the frontal lobe or other regions involved in emotional regulation. These changes may occur suddenly and without apparent cause. Behavioral changes may signal underlying neurological dysfunction and require urgent medical assessment. Sign 8. Nausea or vomiting. Nausea, vomiting, or a feeling of queasiness can sometimes accompany a stroke, particularly if it affects the brain's control centers for nausea and vomiting. These symptoms may occur independently or in conjunction with other warning signs. Nausea and vomiting may indicate increased intracranial pressure due to stroke-related swelling or bleeding. Before we continue, please support this channel by subscribing. Many thanks if you did subscribe. Sign 9. Sudden onset of severe fatigue. Sudden and unexplained fatigue, exhaustion, or a feeling of being overwhelmingly tired, especially when accompanied by other stroke symptoms, can be indicative of brain ischemia or hemorrhage. Fatigue may arise due to the brain's increased demand for oxygen and energy during a stroke, requiring immediate medical attention. Sign 10. Trouble swallowing. Difficulty swallowing, known as dysphagia, can occur due to stroke-related damage to the swallowing muscles or neurological pathways involved in swallowing coordination. This symptom may lead to choking, aspiration, or difficulty managing saliva. Dysphagia poses significant risks for aspiration pneumonia and requires prompt evaluation and management by healthcare professionals. Sign 11. Sudden sensory changes. Sudden changes in sensation, such as tingling, numbness, or hypersensitivity in the face, arms, or legs, can indicate stroke-related damage to the sensory pathways in the brain or spinal cord. These sensations may be unilateral or bilateral, depending on the location of the stroke. Sensory changes can impair daily activities and warrant urgent medical assessment to prevent further neurological deficits. Sign 12. Loss of bladder or bowel control. Loss of bladder or bowel control, also known as urinary or fecal incontinence, can occur in some individuals experiencing a stroke, particularly if it affects regions of the brain responsible for bladder and bowel function. This symptom may manifest as sudden urgency or inability to control voiding or bowel movements. Incontinence may result from stroke-related neurological dysfunction and requires immediate medical attention to prevent complications such as urinary tract infections or fecal impaction. Sign 13. Sudden changes in consciousness. Sudden changes in consciousness, ranging from mild confusion or disorientation to loss of consciousness or coma, can occur in individuals experiencing a stroke, particularly if it leads to brainstem or global brain dysfunction. These changes may be accompanied by other warning signs of stroke. Alterations in consciousness indicate significant neurological impairment and necessitate urgent medical evaluation to identify and address the underlying cause. Sign 14. Facial drooping. Facial drooping, asymmetry, or weakness, especially on one side of the face, can be a classic warning sign of stroke affecting the facial nerve or motor pathways controlling facial muscles. This symptom may become apparent when attempting to smile, close one eye, or raise the eyebrows. Facial drooping is a hallmark sign of stroke and warrants immediate medical attention to assess for other neurological deficits and determine the appropriate course of treatment. Sign 15. Transient ischemic attack, TIA. A transient ischemic attack, TIA, often referred to as a mini-stroke, is a warning sign of an impending stroke and should be taken seriously. TIAs manifest as temporary episodes of neurological dysfunction, such as weakness, numbness, or speech difficulties, typically lasting less than 24 hours. TIAs indicate underlying vascular disease and carry a high risk of recurrent stroke if left untreated, emphasizing the importance of prompt medical evaluation and preventive measures. As we conclude our exploration of stroke warning signs, remember that recognizing these symptoms and seeking immediate medical attention can make all the difference in saving lives and preventing long-term disability. Stay vigilant, stay informed, and together, let's raise awareness about stroke prevention and early intervention. Until next time, may you stay healthy and safe. We love to hear your thoughts. Please drop a comment and don't forget to subscribe.